So, you guys, we're to the last lesson of this course, which has been absolutely phenomenal.
Thank you.
And I think that the work you put into it is amazing. And one of the reasons that we asked you to do this course is because you took your practice and pretty much did a 180. And the way you did it is you took most of the things that you've learned here that you just got done talking about, and you implemented it, which is really, as you know, that's what you've talked about. It's one of the hardest things to do is to implement what we've done. So I thought, even though you really covered pretty much everything in your course, that we'd finish by, I'm going to throw out some sort of rapid fire questions, just to maybe get some bullet points to really solidify everything that was in the course. Is that all right with you guys?
Sounds good. Yeah.
So I have
great.
several questions here I'm going to throw out at you, and just sort of let's just go for it, and,
Okay.
and we'll go from there, okay?
Great.
So my question then is this. There was something going on in your practice. There was something that caused you to want to make a change. And so what I'm wondering is what was it? What was that, maybe the straw that broke the camel's back that you said, we need to make a change? What was that?
Well, it wasn't like a specific moment that caused us to change. Over the years, we would go to lectures and workshops and things, and you see Frank or Greg, and they're putting up this amazing dentistry, and you start to get a little bit jealous. And you want to be able to do that type of work in your own practice. And we felt like we could, we felt like we could change. We had the confidence in ourselves to be able to do that. And, we went into practice with our father right out of school, and it was already an established practice. So we kind of already had the foundation, and we had each other to be able to actually, bounce ideas off of. We kind of had our own like mini study club in the office.
Yeah, and I think that in South Jersey, we literally have a choice for a dentist around every corner. So I think one of our main goals was to really try to set ourselves apart from the competition and have patients really see a difference in our practice. And we really, it just couldn't only be with us. We really needed our whole team. We needed this whole systematic entire office change. And we honestly felt like we could give a little bit more to our patients and kind of cause this like shift in mindset of the overall patient's care.
That's awesome. So on to the second question then. Did the changes, were they subtle? Like what did the patient see? What did the team see? What was it did they see a big change, or was it subtle changes that both the team and the patient saw?
We really gave a lot of thought to this question before we implemented this whole change. So we said to ourselves that we think the best way to go about implementing is to do it at a slow pace, meaning we just wanted to introduce one or two things at a time to not let our team members get too overwhelmed, because we felt if we implemented too fast, it could create a little bit of frustration and we could lose some of the team members. Yep. So I think one of our biggest challenges was with longtime team members. They sort of looked at us like, why fix what's not broken? A lot of them have been in the practice for 10, 15, 20 years, and they've been successful and it's been rewarding. And we just told them, look, let's just give it a chance. Let's try something new and we'll see how it works out. We can always tweak or change it a little bit. So we can always go back to the drawing board.
It was noticeable for all the team members, but True. Not really in a negative way. I mean, a lot of the team members were actually excited about what we were doing. And it wasn't really noticeable to existing patients, if you think about it. It was actually the new patients that it affected the most, because a lot of the things that we changed affected new patients first. So the change wasn't really like that palpable from an existing patient standpoint. And for the new patients, they kind of thought that this was how it's been done forever, and they never knew that it was any different.
Well, all right, that makes a lot of sense. So now my question is, what was the first thing you changed then, and why did you pick that to be the first thing you changed?
Well, the first thing we decided to change was the comprehensive exam. And we really had three reasons why we wanted to do that. For one, it was an opportunity to be thorough with our patients. And, you're checking out a whole bunch of different things. And it lets you start to detect a lot of problems and start to have a lot more conversations. Also, from a personal standpoint, you get to have longer, more meaningful conversations with the patients. So you get to kind of build a rapport with them right at the very beginning. And I think the main goal in this entire process was to kind of set ourselves apart, like you had said before, and be a little bit different from what they've experienced in the past. When patients sense a difference, they start to kind of open their eyes and their ears to a different approach.
The other thing we decided to implement was photography. And, photography is really applicable to all the clinical providers in our practice. I mean, as doctors, we're taking a series of about 17 photographs. Our assistants take 7 photographs on all of our new patients at their initial visit, as well as use the intraoral camera to point out specific problems for individual teeth. And our hygiene team uses the intraoral camera during the hygiene visit to make patients aware of what they're seeing. And no matter what type of photos we're taking, they're typically up on the TV screen in the operatory. We look at photography as being very beneficial as far as educating our patients on a daily basis. We feel the diagnosis and treatment planning aspect of dentistry has become more accurate and precise. And, there's also the self-assessment aspect of it. We're kind of hard on ourselves, and when you see it in the photograph, it's, you can't really deny it.
Makes you want to get better.
Makes you want to get better, absolutely. And from each case that we do, we want to get better and better, and it really helps with the communication with our lab as far as, shade matching or color of a tooth that we're trying to mask, or maybe a photograph of our temporaries that we're trying to mimic. And then ultimately assists with a lot of insurance reimbursement as well. Insurances are getting more challenging to deal with, and we figured the more documentation we can provide to them, the better we can assist the patient in utilizing those reimbursements.
Well, that also makes a lot of sense. So now sort of to dig down real deep, because I know a lot of people have this question that I'm about to ask you, which is, were there any products or supplies? Because sometimes that's what it's all about, that really helped you make the change. So what products or supplies would you recommend to the audience watching this that might help change their practice or transition their practice to something like you guys have?
Yeah, one of the best machines in the practice is probably the MiniStar machine. And we made this purchase after the occlusion workshop, and we learned all the benefits of it. And we make our own night guards, whitening trays, retainers, copyplash trays, and it does so much that we first learned how to do everything ourselves, trained our assistants, and now they really have put in a good tracking system, and we're fabricating different types of appliances on an everyday basis. The other thing is electric hand pieces. We made that purchase after the restorative design. We did RD and ARD. And we utilized them during those workshops and really saw the difference it made in comparison to the air-driven handpiece. The torque it provides, the ability to adjust the speed when you're adjusting certain ceramics so you don't risk the chance of fracture. And they're quieter, so obviously something that patients really appreciate.
Yeah, and then we have also, we decided that we wanted to purchase a semi-adjustable articulator, and we actually went with the SAM 3. Along with its face bow. This is something we constantly use here at Spear, so it's an easy transition from we learn here at Spear how to use it, and then we take it back to the practice, and it's an easy thing to be able to implement. When we did that, we had to get our lab to also purchase one, but he was right on board with it, and he knew that we were going to send more cases to him as a result of him having the same articulator.
Now we're almost fighting over it.
Yeah, and the other thing that is probably the most important thing you can purchase is cameras. And, Dave was just touching on this before, but, an intraoral camera, and we have a few of them. We have, I think, 3 or 4 in the practice right now. We have them in hygiene. We have them in the operatories, just to make sure that, we're getting photographs at every step along the process. And then, obviously, a digital SLR camera. We have a Canon Rebel. And with mirrors and retractors, it's so crucial for us to be able to have, good in-depth consults with patients, and that really helps us to tell our message and tell the story to the patient. So I think that's probably the most important thing that any doctor can really buy for their practice is some cameras to be able to help them tell the story.
So speaking of the camera, and you know how important it is, you've talked about it, to implement photography into the practice. So how has it that what have you done to implement that into your daily schedule? What is it, how does that flow in your daily routine?
So we treat photography as a procedure in the office. Just like you do a posterior composite or a crown or a retainer or anything like that, you we have actually a procedure code for us to actually do it. So we have two separate codes in the practice. One is photo, and one is doctor photo. And the photo is typically attached to the appointment when we're trying to cue the assistant that they're going to be taking their 7 assistant photos. And then the doctor photo is for when we're taking the 17 photographs prior to having a consultation with the patient. And in our practice, there's no charge for photographs, but we do charge for models. And, Dave mentioned in another module, actually, that, we need to be the change. And this was a perfect example. We needed to lead the way when it comes to photography. We needed to really adapt it, and we needed to really actually do it ourselves before we could actually expect anybody else to do it. So when the assistants and hygiene, they saw us doing it first, they felt a lot more confidence in themselves to be able to do it.
Right. Yeah. So, as far as our assistant photographs, like I said before, all the assistants are taking 7 photos on all of our new patients. And this is happening during about the first 30 minutes of the appointment, along with the preclinical interview and any x-rays that are necessary. So those photos are then put up on the TV screen for the patient to view. They're easily downloadable into the computer with a card reader. And, it helps us to, as we're explaining things to the patient, at least they have some type of visual to look at, so that it's not just words being thrown at them. And like I said before, they're also using intraoral cameras in the practice for more individual teeth, and hygiene is pretty much only using intraoral photos during their visits. And we would prefer that those pictures be up on the screen when we enter the room, so that we know that the hygienist has already used that picture to help tell us a little bit of a story, and then we just help to reinforce that when we come into the room.
And on that note, one thing that we noticed with hygiene, we started to make it so that we wanted them to take more photographs in their rooms. And at one point, they got to the point where they were just taking photos just to take photos. I mean, they were just doing it just to kind of show us that they were taking photographs of different teeth. And that kind of led us to having some follow-up meetings with them about really the importance of taking photos that are relevant to the patient. So, if the patient doesn't have any photographs that are needed, then don't take any photographs. But if there's something there that you can really tell a story about and really have a conversation about, it's really important to take that photograph and have that conversation prior to us even getting into the room. And that way we can then just reinforce anything that they talked about.
Right.
So photography is a big deal, but going back to the comprehensive exam, is it just the comprehensive exam that you changed? Like you just changed the exam? Or were there other things you changed to help implement and utilize the comprehensive exam?
It really was a lot more than just the exam. And like we said, we thought the exam was a great place to start with new patients because they think we've been doing that this way forever. So, but it couldn't just be us, like we've stressed over and over. It really needed to be our entire team that was on board. So we stressed this overall experience. And like Mike had stated in one of his lessons, we took out an entire day for the team, called it the experience, and really just ran through every aspect that we thought made sense with feedback from the team. I mean, it all started with that initial phone call. We said we put someone in place to be our new patient coordinator to handle most of those phone calls, and they would gather as much relevant information as possible. They would then share that information in our morning huddle, which takes place about 10 to 15 minutes before the day starts, just to get everybody on the same page. And then they would offer, once the patient got into the office, that new patient coordinator would greet them, we have an amenities menu, things such as neck pillow or blankets, iPods, and and then once they've received all that information, we prefer that new patient coordinator really hands off that information to whatever assistant's going to be taking care of the new patient for that day.
Yeah, and then at that point, the assistant brings the patient to the back. They're taking their 7 photographs, as we've talked about. They're taking any necessary radiographs. And they're doing a preclinical interview just to really establish a good baseline and go through some good Q&A with the patient. And then there's a handoff between the assistant and the doctor. So what we actually prefer in that situation is we actually like the assistant to actually come back to our office a lot of times, so it's behind closed doors, so that we can actually have a conversation about what they found out about the patient. And then when we go into the room, We're just relaying a lot of that information that they told us so that they see there's communication that's just actively occurring in the office. And then we get into the comprehensive exam, which is what we learn about here at Spear. We learn about the examination aspect of it, but all the things leading up to the exam, we kind of had to tweak and make our own. And honestly, some of these exams, they don't even end with just one visit. Some people need to come back for a consult, and we talk about this in another module where some people need what we call a mini consult, where we get the patient back maybe for a filling or two or a cleaning, and at that visit, we schedule another 10, 20, 30 minutes where we just kind of review our findings, or we do a full consult, and that's 18 photos, models, getting them in for 40 to 50 minutes for a full consultation. And then it all ends with the financial coordinator or the treatment coordinator to then schedule any necessary appointments, go over the financials with the patient. But like Dave said, this is just an overall experience that we came up with and an overall flow within the entire office.
Yeah, and one other point is that in regards to that comprehensive exam, I could speak for us in that as far as the actual exam form goes, we've probably changed our form 3 to 4 times at this point. So, we're going to share it with you, but I would say really look through it and customize it to what makes sense as far as the conversation or dialogue that you really want to have with the patient.
Yep.
Well, so you mentioned the consult there again. So you've taken the photographs, you've really implemented a nice comprehensive exam. Sometimes, especially when you start doing dentistry the way you're doing it now, the patient has to come back for a consult. Sort of a pain in the butt. Some people don't really know how to do that. So what are you doing to implement the consultation in your practice? What are you saying? How's that going for you?
Yeah, so again, it's about a 40 to 50-minute visit with the patient. There's no charge for the consult. We again, we'll use the photos that we take, the 18 doctor photos, and mounted models, and we put them on our the SAM3 articulator with the FaceBow, and we put it all in a keynote presentation. And over the years, honestly, it's just taken trial and error when it comes to the keynote presentations. When I first started, I was using PowerPoint and trying to put together different pictures and arrows and circles and all these things to point out things to patients. And it's just a nice way to really clarify your message when you're trying to have that consultation. And more recently, we decided to have somebody else in the room with us. So we have a treatment coordinator. Her name is Beth, and she's in the room for all of our consults, so that she's just another resource for the patient after the visit's over, so that if they have any questions or concerns or anything like that, they can easily reach out to her, and she can hopefully answer any of their questions. And then she also has follow-up with the patients after the consults are over.
Yeah, really helps to bridge that gap between the doctor and the patient. Another thing we did was, as far as the actual content of the consultation or the nuts and bolts, we used to always start our consultation or that keynote presentation with the lips at rest or lips in repose photo, sort of like how we were taught to follow that sort of EFSB structure. And, after doing it like that for a while, we'd have some patients looking at us and saying, why are you sort of starting with this when I told you that I wasn't happy with maybe another aspect of their mouth? So we kind of changed our approach over the years, and we always start with their chief concern right off the bat. That way we really get to engage the patient right away. And we still treatment plan the same way in that EFSB, but even if it's just a functional conversation that we're having, or maybe we're using a limited amount of photos and mainly the articulator to explain the situation, or the TMJ tutor or BiteFX or something along those lines, we'll still offer the patient the opportunity to discuss those other things, such as aesthetics or structure. And if the patient's not interested, then we don't discuss it, but at least we have that available if needed.
Yeah, I think just to add on to that too, you were saying, about how we used to always start off with like lips at rest. And I think that part of that is, in the beginning, we were trying to show patients like almost how much we know, like
Right.
it was like,
Yeah.
oh, well, this is where we start our treatment planning process. When in reality, that's just not what the patient's coming in about. Like they don't, that's how we have to treatment plan. But when we're presenting to the actual patient, sometimes it doesn't really click with them.
Sure.
They're looking for, they have a chief concern. And if we don't address that right up front, then, some patients can get kind of confused or aggravated.
Right.
Yeah.
Right.
So that makes a lot of sense. And so I got one more question for you, if you don't mind. Because as people start to transition, as you guys have, you really have to have some confidence, right? But before you can be confident, sometimes you have to have the competence for that. So let's just wrap it up by talking about, where do you get your competence? What would you recommend people do so that they can gain the competence, so they can have the confidence that the two of you have?
Yeah, I think our dad deserves a lot of credit for this. I mean, when Mike and I first got out of dental school, my dad was always really involved in a lot of continuing education, saw a lot of different lectures and went to seminars and all kinds of things. And he really guided us in the direction and said, you really should go see Frank Spear. So I can remember back in 2005 when I just graduated dental school, my dad had signed us up for the facially generated treatment planning seminar, and it was out in Las Vegas. And I think I learned more in 3 days than I did in 4 years of dental school. I mean, yeah, it was sort of was like this fire hydrant, meaning like, it was all this information just being thrown at you at once, and you just tried to absorb as much as possible. So then we started to take the rest of the hotel seminars. We did some down in Florida. And then, once Mike and I we got caught up. I think, we started to say, let's go and really start attending the workshops. And our first workshop was out in Seattle with Dr. Spear, and it was really life-changing, like Mike mentioned. And I think that the whole education philosophy of Spear, they've really put in a nice curriculum to follow. And, the workshops are a much smaller, more intimate environment where, you really get that more one-on-one attention, really able to refine your skills. And, just really from the workshop, taking things back to the practice is really, where it is.
Yeah, I would agree with you. I think that, kind of picking up where, when we went out to Seattle and we went to the facially generated treatment planning workshop, I mean, it was a life-changing event for us. I mean, we were doing the comprehensive exam out there, and Frank was doing it on us, and it was like, the experience that we had with that. I remember, Dave and I, we always challenge each other. So we're lucky in that, we can bounce things off of each other all the time. So it'd be good if you have a colleague or a business partner to be able to do that. But we're very lucky in that regards because, we don't just look at these opportunities as just great education experiences. We say, like, how can we really take this back to our practice and ultimately implement it? And, that's what this whole module's kind of been about. And, we hope you enjoyed it, but, it takes a lot of work, then you need meetings and you need follow-up meetings and you need the right team on board, both in your office and out of your office. And, I think all these things added up. That's what really gets you to get the confidence to be able to do it.
Well, you guys powered through those questions very well. You're very intentional with the way you were ready for those, and I think it was really helpful to sort of wrap everything up.
Yeah.
So I just want to say, honestly, like, this is a big deal for us to take somebody like you guys who have changed your practice, implementing things that you've learned here and sharing it with everybody else. I think that's a big deal. So first, I commend you.
Thank you.
And second of all, thank you for doing this. I think it's going to help a lot of people. I think you guys are great, and so many people are going to be helped. So thank you.
Thanks
for having us.
Thank you very
we
much.
appreciate it.
Awesome
That was
course.
great.
See you guys next time, hopefully at a different course.
All right,
Thanks.
sounds good.
All right.
Appreciate it.
Yeah.